So if you look at the Value Explorer, it's focused in on the three stakeholders, or what I call the three Ps. You have the patient, the provider, and the payer. So let's look first at the payer, right? The Value Explorer, by measuring the time-driven activity-based costing per physician over an entire life cycle of care for a specific condition, and you can segment it by a population, allows the payer to get valuable information. They understand the cost better of what it costs for that delivery of care. And secondly, they can also say, well, wait a minute, why is somebody getting a better outcome versus not? So in other words, they can be using it for fraud detection or propensity to treat. So that's going to help the payer in terms of what providers they're going to refer their patients to, as well as how they're going to best manage their costs. The second stakeholder is the provider. The provider can use the Value Explorer because it was built from the ground up for healthcare delivery organizations and providers to help them in terms of understanding whether or not they're getting the desired outcome that they want, and how are they doing it in a cost-effective way. And so the provider can use it as a tool to train other providers. They can use it to determine what is the best route of care for a particular patient or segmentation in terms of managing a population health. And then they can use it also for predictive analytics in terms of staffing. I think what's also unique for a provider is if you're an organization looking to grow, that you can use it in terms of recruiting new people, right? I mean, I see a world where you could start to use it to evaluate new medical students coming in as interns and how well they're doing, and whether or not you want to keep them on board long-term as an employee. I see it if you're trying to open your independent practice, understanding, where do you want to go and opening your practice for a specific condition. I also think that the providers can use it in terms of how they're going to navigate the complexities of CMS reporting. How do you show and articulate value to them so that you can be profitable in an era of bundle payments? And then the last one is probably the most important, is to the patient themselves. I think you're going to be able to give transparent choices and really create consumer-driven healthcare through use of a Value Explorer type product, where you show, hey, if you take the red pill, you get this. If you take the blue pill, you get this. I mean, let's empower our patients to make the decisions they need to for their families based off of objective, quantifiable data that matters most to them for their particular condition. So I think that's the value that a Value Explorer product brings to an organization for those three stakeholders.